On behalf of Delta Epsilon Mu, we would like to thank you all for coming tonight. Please give it up for Dr. Lynn, Doctor of Physical Therapy. Woo!
Let's have Jasmine introduce.
Hi, everybody. So thanks for being patient. We had a bit of a technical snafu. I do PR for Dr. Lynn. I graduated from UCLA, so I'm part of the UC family. And it's kind of a miracle that I'm standing in front of you because 8 months ago, my feet did not work at all. I had broken this one and had severe problems in my left one. And I was unable to walk after being super active for most of my life. I couldn't get around without a wheelchair. I had to wear special shoes. I was completely immobile. And obviously, it's not okay when you're 30 to not have feet. So I decided to go to doctors. At which point I was told by 2 or 3 different orthopedic surgeons that in fact I had a rare condition called sesamoiditis and I needed to get both of my sesamoid bones removed, after which point my feet might not work again and I would be either wheelchair bound or I would have to get titanium implants in my feet, so on and so forth. Nobody suggested that maybe I was walking wrong or maybe I had another issue that originated my pain. So what did I do? I cried and I moaned, and for 6 months I just sat around like that's the end of it. And eventually I decided, after some goading from my boyfriend, that maybe I should look into physical therapy, which I did not count as something that could help me, but I decided why not. So I researched physical therapists in Orange County, and lo and behold, Dr. Lynn is #1 by a long shot. So I thought, okay, well, we'll see, probably-ish, right? And there was a bunch of stories about how he's a healer, and now my body's working, and I was like, sure, why not? So I go in, and this is what Dr. Lynn looks like. I did not expect Dr. Lynn to be young and good-looking and be like, how's it going, Jasmine? Instead of being ushered into a dark, cold office after waiting for 45 minutes and paying $400 and seeing a doctor for 30 seconds who was like, stand if you can. Yeah, you got an issue, you need surgery, it's gonna be $15,000, maybe it'll work. Dr. Lynn sat me down and said, what's up? Looked at my feet. The first thing he did was make me take a test. What did I do? I stood there and he pushed on me and I was like, ugh. And no, legitimately, I had no strength. And at that point, he said, these are the things that I think are wrong. And it doesn't look like it's just your feet, but let's start working on your feet so that you get a little bit of trust. So 3 months into it, I am standing in front of you. I am wearing normal people's shoes. Hopefully I will be wearing heels soon, just like you girls, like I used to wear all the time. And there's a reason that I decided to work with Dr. Lynn, and it's my honor to represent him today, because when you are immobile, and when you have nobody you can trust and you do not want to get surgery and you want somebody who's going to say, you can do this with me, we can do it together, that's when you call Dr. Lynn. That's when you become a physical therapist. So without much more further ado, Dr. Lynn.
Thanks for having me, everyone, and thanks for Jasmine for starting off. I think this is a prime example of the typical patient that comes into my clinic a little bit helpless, a little bit in despair. They're looking for that magic pill, but you realize, I think Jasmine would attest to this, that you realize that this is a process, and this is a long process. It also, the hard part is getting it through to patients that it's a lifelong process, that you're going to continue and you're going to evolve as a patient, as a person, as whatever you want to do in recreation, or if you want to be an athlete, or if you just want to wear high heels. Right, Jasmine? But yeah, I mean, my story actually is not very different than Jasmine's. Mine just started a lot earlier. So a little bit about me and Jasmine. I went to Boston University for my graduate. Is this on? It's on, right? I went to Boston University for my graduate. It was a 5-year expedited program where they chopped off your senior year and they made it your first year of graduate school. Now, I grew up actually right around the corner. I went to University High School. coming out of that and going into basically an accelerated program, and it's pretty difficult. But you lasted through. You ended up with a Bachelor's of Science, and you ended up with a Master's of Science, and that's what it was about 8 years ago. You can practice with a Master's of Science. Now it's a little different, and I'll go into that in a little bit. But I went on that journey, and so that's a little bit of my background. I got my Master's of Science, and then after it all, I was practicing while working full time. I went and got my doctorate in the evenings. So I would go in the evenings to school. I would work 40 plus hours a week, and then I would go and work on my dissertation. I would work on all the little components that I needed to get my doctorate. And then, so I have 3 degrees, BS, MS, and then my DPT, Doctorate of Physical Therapy. And like I said, I'll talk a little bit more about that. But my journey began right over here at University High School. I was a top athlete in Orange County for baseball and football. I was slated to play Division I baseball at one of the universities. I was talking to Coach John Savage over at UCLA, and that was where I thought I was headed. My life was set. Everything came catered to me. I had everything. When you're a top athlete, I think some of you, have experienced that. You get life catered to you, everything on a silver platter, and then all of a sudden it's gone like that. And then what do? I had a career-ending injury, tearing my rotator cuff. I didn't know how bad back then, but I was young and stupid, and I continued to play because I wanted to keep my scholarship. I didn't want anyone to know. What unfortunately had happened when I found out later was that I tore 2 rotator cuff muscles. And if you know anything about the shoulder, there are 4. Okay, so I lost half of them. And so basically, my shoulder would dislocate every time I wanted to reverse in the car. Anytime I picked up a bag and I wasn't thinking about it, it would pop out, and it was excruciating pain. This is unbelievable pain. I wish no one ever has to go through it. If some of you have, then you probably know, or any kind of injury for that matter. And what happened was, once the scouts knew, they dropped me. I lost my scholarship opportunities, and then I was left with nothing. But luckily, I was a big nerd, and I studied hard, and my mom always told me, don't rely on your body. So she's like, you got to stay in school, and you got to do that stuff. So she was right. And so I got into one of the top programs, Boston University, and that's what happened. But in the process, how I decided to choose physical therapy is a little bit different. And so after my football season, my senior year, I ended up hurting it my junior year. But after my senior year, I decided, okay, nothing else. I'm just gonna go see what the orthopedic has to say. I don't know how bad it is, but it's starting to kill me. It's starting to bother my sleep. It was, I had excruciating pain just like laying in bed, and I couldn't feel my arms. It was numb and tingling, and that's just for a 16, 17, 18-year-old, it's unreal. You don't want to live like that. So I went to the surgeon, Dr. Carlos Prieto here. He was doing experimental surgery back then, which is now commonplace. It's minimally invasive arthroscopic shoulder reconstruction of the muscles. Basically leaves you with 3 holes, which I have only 3 holes. But back in the day, they used to cut you right open and open that up, and so you had a scar like this. So I said, let's go for it. Let's see what happens. What he found out through the MRI was I had those 2 muscles torn, and not only that, but I had 50% of my cartilage torn, the labrum, the shoulder labrum. And you hear about that a lot lately in sports, labrum, whether it's the hip or the shoulder. The whole purpose of the labrum in general is actually to keep the suction, to keep the integrity or the stability of that shoulder. And once it's lost, that's why it dislocates, and that's why it pops out all the time, and that's why I ended up probably tearing another muscle that I shouldn't have, that maybe initially was just one. So, I didn't know any better. I didn't know, what was going to go on, but I asked the doctor, I asked the surgeon, I said, what what's the outcome? What's my prognosis? And I said, am I going to play again? Am I going to, maybe I'll transfer to junior college. Maybe I'll play or something. That was my life goal. I really wanted to go that way. I wanted to play really badly, but he sat me down and he goes, it's over. Any dream you have of even thinking about throwing is gone. And you sit there, you're 17 years old, you think you got the life ahead of you, and you're like, I've been throwing things since I was probably like a kid, like probably 2 years old, and all of a sudden I'm never gonna throw again. All of a sudden he said to me, he goes, you're not gonna raise your arm more than 90 degrees ever again. That means I can't play frisbee with my friends in college. I can't go run around. I can't go swimming at the beach. That was a little preposterous in my mind. That I couldn't do something. And like Jasmine shared, you sit there and you wonder. You're like, there has to be something I can do within my power as a patient, as a person, so I can go on and live. I can be what I think I should be. So I asked him, I said, I said, after surgery, there's got to be something I can do. And he wasn't keen on physical therapy initially. I didn't even know what physical therapy was, but he's like, you can go to physical therapy. I was like, well, what's that? And he's like, they give you some exercises and they'll give you a little hot pack and stuff and maybe massage you. And I was like, okay. I was like, is that going to help? He's like, maybe it might help. Maybe it might help ease your pain. And I'm like, okay, well. I said, well, I'll take it up with the physical therapist myself. So after surgery, which was a couple months later, I decided, I chose a physical therapist, and I went to him, and I said to him, I am willing to do anything short of you drawing blood so I can get better. Whatever it takes, I am willing to do. Because I was powerless. I was frustrated. I was... it was just the worst feeling at 17 you can feel. And, I didn't know how much my life I wanted to live after that, but I knew if I couldn't raise my arm, then, it just was, like I said, earlier about just being traumatic, actually. It's pretty traumatic. So that's how it started. So physical therapy was a way. I was working over here. It was a way for me to see some progress and some change. And after 6 months of hard, intensive work, realizing that I needed to put something in to get something out, I was able to raise my arm at least 80%, up to here. Okay, today. So I went back to the surgeon. I said, look, it's a miracle. I can get up to here. And, I was like, oh, my God, this is so great, right? But I wanted more. I was greedy. I wanted more. I wanted more than 80%. But he's just like, wow, that's pretty amazing. Now, if I go back to all the things I learned about this labral tear, about these two muscles being torn that were very important, and it was textbook, Dr. Prieto was right. I wouldn't be able to raise my arm more than 90 degrees. It would be just here. And if I settled with that fact, whether that was the truth, and that's I'm going to talk about it a little later, but when doctors tell you sometimes it's just the law, right? But I want to tell you that there's possibilities. There's infinite possibilities. It depends how much you're willing to look for it and how much you're willing to work for it. So back to the point, it was that the textbook told me, yes, I was going to fit this profile. But the difference and the key was the person, the patient, wanting something more. And that's where we begin our journey. So, like all of you, and most of you here are Asian, your parents are going to push and push. You got to be an MD. You got to be a lawyer, a CPA, an engineer. What's a physical therapist? What's a physical therapist do? Is that even a reputable profession? So the difference here is, actually I need to go back a little bit further, but us being Asians, and those of you that are not, but it's the prestige. Everyone tells you to go to MD. I had the luck of also, when I was trying to figure out whether I wanted to do physical therapy in high school, following 2 medical doctors at the hospital. And I followed them for, I think, a couple weeks, and I followed them for 8 hours a day, for just like on the weekends, and I just followed them, go in and out of patients' rooms, 10 to 15 minutes, and what I started realizing was a lot of what medical doctors do today, and I'm not trying to downplay what they do, but they only spend such a small time with their patients. And that's not what I was looking for. I wanted more quality time, like my PT was spending with me. He spent about, at least had half an hour, and motivating me and encouraging me to get better. So I asked this MD, I said, is this what you imagined when you went to medical school? And he looked at me honestly and he goes, Justin, he's like, no. He's like, I didn't realize I would be pushing papers. There's a lot of paperwork in medicine, I'll tell you that right now. I'll be pushing papers and pills to people. And in a subtle way, I started realizing how powerless they were too of the whole process. How powerless that all you can give is a pill, a shot, nothing, or prescribed surgery. I don't know. That makes you think a little bit. And that made me think. So that's kind of the process of me deciding to go physical therapy in long and short. But I think you guys can see where this is going. So what does a physical therapist do? In general, here's the basic definition of physical therapists. We are specialists. We are highly educated specialists in assessing, evaluating, and treating musculoskeletal dysfunction, which basically means everything in the body. Everything short of drawing blood and cutting someone open, which is exactly what I wanted. So the important thing is, some of you how many of you have gone to physical therapists? Raise your hands. Raise your hands. Okay. And how many of you were generally given exercises? If you were given exercises, hopefully you're given exercises. I hope so. And how many of them were the PT is able to touch you, stretch you, mobilize a joint, or did that come about? So only like 2 after that. Very interesting. So physical therapist is a very hands-on profession. What we do is we do evaluate through either functional tests, like one Jasmine was showing. I did a postural assessment to see if the things that were stacking her body up, her little body, what we call the brain and body blocks, is we want to put those body blocks and stack them up in that vertical alignment. Because when you're in a best alignment possible, you're ready for action. You're ready to incorporate all the muscles that are necessary to prevent injury and to prolong your use of your body for as long as you want it. And so we do functional tests, and then we figure out, we diagnose. We do something called differential diagnosis, because sometimes we end up with something that's not on our plate, and we got to figure out what that is, and if we can help them. And if we can't help them, then they got to go somewhere. Now, the tough part about physical therapists is we're kind of the middlemen. We have to know where everyone needs to go and where they came from and what's about to happen to them. And then on top of that, we have to do what we do well, and then we have to then figure out if they're going to get better. So that's a lot of responsibility in our realm. We have to, we're this mover and shaker. We're almost like the coordinator of these patients' lives. And in a way, that's a very powerful thing. It's a very important thing and a responsibility that a lot of therapists, a lot of medical doctors, a lot of practitioners out there, they don't know that they're responsible for. It's a very important task to direct them the course that they need to do to get the right help that they need. And then on top of that, if you're getting some good care. You're going to get the therapist to put their hands on you, do the right things to put joints back into place, to break up scar tissue, to what I do a little differently, and we'll talk about this a little later, is neuromuscular re-education, which is basically the signals that go from your brain to your body after an injury. Those are the things that lack. Basically, after you've hurt yourself, you shut down, your body shuts down, and it numbs itself, kind of like a stroke in a weird way. That's why people keep twisting their ankle, keep pulling their hamstrings over and over and over again, because your body has lost that connection. And we have to re-implement and re-educate the body to move properly. And that's a programming thing. That's a sequencing thing. That's a neurological thing. And so that's a little something of what I do differently. But in general, a lot of people will prescribe exercises to get that done. Now, it only helps for a few. But how many of you, when you guys went to physical therapy, saw benefit in it? And then how many of you didn't? Yeah, so that's a good amount as well. Too many in my eyes. But yeah, so you can see that there's a process. It's all a process. So how good is this profession? This profession is rated on US News, US Today, as the top 10 best jobs in the nation. You know, they talk about it like, I think over the last 15 years, it's been there, top 1, 2, 3, 4, all the way down to 10. But looks can be deceiving. Sometimes what it appears to be isn't necessarily what it is. What I do want you guys to know about this field is how physically, it depends on your physical therapist, of course, but how physically intensive it is on your own body, on my body. So I gotta stay in tip-top shape. I make it a point. It is my job to go to the gym 3 days a week after a long treatment day. I treat for 10 hours a day, 45 minutes per patient, and that's a luxury in this day and age. But I get to be hands-on with my patients, and then I get to see them develop, and I get to move them along to their healthy journey. But that takes a toll on my body. It takes a toll on my mind. It takes a toll on, all the things, sometimes your spirit too. And after that, you got to go work out. You got to keep your body in tip-top shape. And then, so what happens a lot is physical therapists, they break down. They break down roughly around 5 to 10 years. A lot of them burn out. They burn out really quickly. And so OSHA is also, most medical fields that involve patient care, like nursing and physical therapy, OSHA, which is the occupational health, has rated these health services as one of the top and more injurious professions, ironically. We're trying to help people, but we're ending up hurting ourselves in that process. So taking care of ourselves is really important. Sometimes also, you have to realize what is motivating you to be a physical therapist. I can tell you countless times, as much as there are great patients like Jasmine that are very thankful and grateful, there are many that are not. It's a thankless job sometimes. And in general, for what you put into school and the debt you come out with, the pay is very little. So, these are some things to talk about, because actually, I'm here today to discourage you from two things: the physical therapy field, and discourage you from the healthcare profession. It really depends on what your motivation is in general. Whether it's for money, I can tell you that chiropractors make more money. If it's for prestige or power, well, you could go be a lawyer, or you could be a surgeon. You can be the life of the party. You can be an iBanker. But this one is kind of boring to some, but kind of exciting to others. So there's an interesting thing going on, and whether you guys agree or disagree with what's going on in healthcare policy, for those of you interested, Obamacare is here. And Obamacare is good, tailored for a couple professions in my view, because I've read most of the policy, which is like 400 pages. It's geared for pharmaceuticals. right? So pharmaceutical industry is going to boom in a different way. And it's built and it's geared towards surgery. So if you're looking at something and you're reading this, and I start reading this, I'm like, okay, where's that money going to come from? Well, it's going to come from us little guys here. You know, what is occupational therapy, physical therapy, whatever, you know, any of the little speech therapy, if that's what you're interested in, it's all going to come from. So it's a very important time to understand this. Obamacare is planning to reduce our reimbursements, which means your pay, our reimbursements every year. There's going to be percentage cuts, changes, lots of changes that are happening, and a lot less power in our realm. So, like I said, it's a grim future for whatever reason. A lot of it comes down to the dollar. This is forcing our profession to then be imprisoned, or not necessarily imprisoned, but being dictated by insurance companies. Now, insurance companies are telling you what you can and can't do for the patient. So that's also a powerless feeling. There are tons of restrictions that are being imposed on our profession because athletic trainers are trying to take a part of our scope. MDs, chiropractors. In California alone, they just passed a new law last year that physicians now can own their own physical therapy practice, which, if you're going to ask me to sit on a soapbox, which I will a little bit, is unethical. That's a self-referral. That's a kickback to themselves. So physicians now are going to tell you, go to this physical therapy place, and they have a financial interest in it. Now, do you think they're being guided by the right things to help their patient, or is it by money? So this is what's going on. And this is what you guys have to think about. This is the world you're going to be coming out of. Whether you graduate from physical therapy school, MD school, you're going to be viewed in a very different way by society. And the current status of the society itself being quick fixes, instant gratification, Instagrams, iPhones, all that stuff is really changing the way you think about healing, the process of healing, and how important it is, like I said in the beginning. And that's why I started off with the process. That's why Jasmine even talked about the process that she went through. So what would it take from you as you guys are sitting here and wondering where you want to be in the next 2 years, let alone the next 5, 6, 7 years? But you're going to have to look deep, and you're going to have to look at yourself and understand that it's going to take some guts to fight, to figure out what's going to happen next if you really want to help and care for people. If that is something that you really care about and that is your interest, you should take mentorship, internship opportunities. I have a couple interns here. They're going to talk later about their opportunity with me. But if you have a chance to learn from someone, good or bad, regardless, sometimes it's a bad experience, it's just a good experience as well. You're just going to learn. And the more you can learn, the better you're going to be ready for this, 2020s. So you have to understand learning is a continual process, is a lifelong process. And the more knowledge you can get, the better you're going to be, and the better you're geared for whatever profession you choose. But like I said, there is a silver lining in all this. And if you know anything about the study about happiness, people always tell you serving others, truly serving others, is one of the most happiest and most fulfilling things in your life. And I can't tell you that enough, what I get to do every day. So let's talk about physical therapy school in general. I haven't really talked about that. But physical therapy school, after undergrad, make sure you have your prerequisites, which include the sciences. If you have pre-med or your physics or your bio, that generally covers it all. You do a couple years of physics or a couple semesters of physics as a prereq, biochem, orgo, all that fun stuff you guys are probably starting off right now with. How many of you guys like biochem? I fell asleep in that class all the time. My notes were like this. I was like somewhere in like a classroom like this. But after that, you apply, you take your GREs, you do some interviews if you want at some schools, you go to an accredited school, and now basically I believe all schools have converted to a doctorate of physical therapy program, which is roughly around 3.5 to 4 years. What it encompasses is curriculum based off neurophysiology, neuroanatomy, human anatomy, gross anatomy, functional anatomy, which is how the body moves with the muscles and why they move the way they do. You learn about cardiopulmonary, which is the heart, lung. Sometimes there's therapists that can go into heart and lung care. Basically, you can go and choose whatever. It's such a great profession where you can choose one thing and then you can jump to another thing and jump to another thing until you find whatever fits for you. And it encompasses all. You can work in the hospital. You could, like I said, heart attacks. You could work that cardiothoracic, cardiopulmonary tract. You can work in the NICU for a neonatal intensive care unit. You can work with developmental physical things for kids. You can work with geriatrics. You can work with wounds. You can work with what I do, which is chronic pain, orthopedics, sports medicine. So the world is your oyster in this field, but like I said, slowly it's getting cut down from what people are trying to take from us. It's getting chomped at the bits. The other course works, I think I covered that, but there's also three, in your education, there's also three rotations you do. You usually do one that's an acute, which is basically working in the hospital right after surgery. Sometimes you're working on a surgical floor, and then you go, or you work in the intensive care unit, which is where I did my rotation. And then you work in an outpatient place somewhere like my clinic, which is deals with people that can drive in, they can get to your office, get some work done, and then leave. And then you can either do neuro, you can do pediatrics. It's like a kind of a free-for-all elective one, something that interests you. Cardiopulmonary, and this usually kind of like a lawyer. Your third rotation is usually where most people will want to hire you and keep you. So what you come out with, like I said, you come out with a doctorate of physical therapy degree. It's a clinical doctorate. It doesn't mean you can prescribe anything. It doesn't mean you have any much more cooler, like gear than anyone else. But what it does is it's just the highest level of our profession. We're getting to the doctorate degree, which then is moving towards what the American Physical Therapy Association, which is our professional association, which set out for Vision 2020, which is in about 6 years, but I was around and I was in college when they set that together in 2000. And the way it's going perfectly. There's the goals of it basically have been to get all schools to be a doctorate program, entry-level doctorate when you come out. To have direct access, which is what we're fighting for right now, which is just patients coming to us, not having to circumvent and go through all these little structures, to get prescriptions to then see us 3 or 4 weeks later. And then we're trying to also become the practitioner of choice. We're trying to get people like Jasmine, instead of going through the heartache that she went through, to come to us first for anything that's related to musculoskeletal dysfunctions or injuries. You shouldn't have to go to MD first. You should come to us because we've got the education, we've got the training. Oh, back. Let me take a step back. Also, in courses now for your doctorate, you're learning about radiology, pharmacology, and how those affect your patients. So that's what's stepped up for the doctorate of physical therapy, and you learn a little bit about business and marketing. So not a lot, but it's enough to kind of get your feet wet, see if that's of interest if you want to be your own practitioner. And then we're going towards more research-based therapies. So there's a lot more research being pumping out, showing doctors, showing surgeons the efficacy of what we're doing. If Dr. Prieto had read something that, yes, physical therapy could help, then he would have been more confident to tell me I should go to physical therapy right after the surgery versus being wishy-washy. So I got lucky, I had the determination, and I went that way, but it's something different. So the profession as a whole, It's set with good intentions. A lot of people are driven for that intrinsic value, the good intentions. They're probably one of the most dynamic, interesting people you'll ever meet. But just like any other profession, whether it's PT, chiropractic, sometimes there's liars, there's cheaters, there's ones that exploit the system more than others. So those are things you have to think about. Sometimes one experience, I don't know, isn't enough to give you the general sense of what this profession's all about. So you try different ones. So what do you do when you get out of school? Or what do you do in general when you get out of your professional school? Make sure you learn and you never stop learning. Make sure, like I said, you go through your mentorship opportunities. Try to email people, try to figure out who the best are, and try to learn from them. If they have the time to give to you, then take it. I did that. I got lucky. I have 2 great mentors that have put me where I am today. See as much as you can do and do as much as you can do. And just realize that it's not going to be easy. So choose this profession if you have the passion to encourage, the passion to inspire, motivate, be a teacher day in and day out. Understand that you are a role model in the community and you're committed to lifelong learning. So I want you to go back tonight and ask yourself, is this for you? And some of you have it determined. Some of you are, wavering. But like I said, there's not that many extrinsic values in being a physical therapist. There's a ton of intrinsic value. And so if this is what you want and you understand you have a place in it, then this is for you. If you're driven by those other things, greed, money, your ego, then don't do it. Don't come to this profession. There's plenty of those already. So like I said, I'm here to discourage you, but encourage you. I'm looking for the very best and the brightest to step up to the plate. Because I need those with the kindest heart. I want those with the kindest heart to call my colleagues. I want those that are going to motivate and push this profession towards progress. As I mentioned before, and I didn't really talk about it, but sacrifice and responsibility are 2 things that lack in medicine today. Whether it's a surgeon, physical therapy, it doesn't matter. And a lot of people are not willing to put that risk out there, not willing to go that extra mile for their patients. So I want you guys to remember not to forget about that. It's okay. Sometimes you get burned. Sometimes, you have an attachment to a patient because you were working really hard and then they said, you hurt me and, you're a bad therapist or you're a bad professional, but you have to keep on moving. And lastly, I firmly believe being better at this profession makes me better at the other profession, life. I have patients that change my point of view every day. I have sessions that change my life, that define my life. And this is my choice. I choose to encourage, educate, empower everyone every day. And this is why I show up to work. Thank you.
So obviously I'm motivated and I'm not even going to be a doctor. But girls, if you could uncross your legs, that would be awesome. Because that's probably the most detrimental thing you're going to do to your body as a girl, sitting around all day. I wore 4-inch Dior heels every single day for like 10 years and crossed my legs and looked awesome and didn't realize that I was standing like that and locking my knees and putting severe stress on my feet and on my pelvic region, and now I don't. What did Dr. Lynn teach me? I have a part in how I'm getting better. I probably have the biggest part in how I'm getting better. Because after I leave the office, I have these tools. I know how to stand. I know how to bounce. I know how to spring. I know how to be aware of the things that are habitually wrong with what I am every day. And no other doctor informed me of that. Everybody said, this is what you have, and this is how we're going to fix it. It's a symptom, is what I learned, of what I'm actually doing every day. So just keep in mind, if you can help people understand that, if you're going into the medical profession, remind people that what they do in their daily lives is just as important as what you're going to help them do. It's also about empowerment, as Dr. Lin said. It's about options. He gave me the option to get better. It was in my hands to do that and take advantage of it. So we're going to have Rochelle and Vaughn come up and talk about why they are interning. And I'm going to tell you a quick story, because I know it's late and you guys want to get home, but I'm going to tell you a quick story about what I watched as I do marketing for Dr. Lin, not as a patient, but just as a person. And I'm a political ghostwriter by profession, so I'm all about telling stories and learning what the motivation and the origin behind what people do is. And I will tell you about in 30 short seconds.